Hello, this is John Woods with Focus Real Estate, brokered by eXp Realty, and today I'm here with Dr. Shawn Weeks of Weeks Integrative Medicine. How are you doing, Dr. Weeks?
Hey, doing good, John.
Great. Well, let's jump right in. I wanted to ask, I know there was a story about how you opened up this business and got into this field of medicine. Heard you're originally from Albuquerque. You spent some time in Alaska, and you were a history professor. Is that right?
Indeed, yeah.
Okay. Did you teach history up in Alaska?
No. That was here.
Okay.
I was born here, but did most of my conscious childhood up in Alaska, and then moved back here because this is where a good chunk of my family's from. The Villanueva and Otero clans are all in New Mexico.
Okay, very good.
And I initially got a bachelor's in history and German, and then a master's in history before realizing I didn't want to move on to a PhD in history and decided to go into medicine. But yeah, I taught at a few smaller schools. I taught online for the University of Phoenix and that sort of thing. And, I really enjoyed the teaching of history, but decided that I think I wanted to do something a little more hands-on with medicine, and that's kind of how I ended up doing pre-med. And as I was doing pre-med, you spend a lot of time getting asked, what kind of doctor do you want to be, and why do you want to be a doctor? And if you answer a question a few thousand times, you actually, really think about the answer. And so the answer I came up with is I wanted to do primary care because I wanted to help people with the quality of life things. My knees hurt, my back hurts, I don't sleep well at night, my guts hurt, I'm tired all the time, I don't poop, I poop too much, my menses hurt, everything's bad, and all of those sorts of things. The little quality of life things that really can make a huge difference in your life.
Okay.
And so the more time I spent, though, in hospitals and clinics and shadowing doctors and doing all these things, the more I realized that there was some areas of our primary care that just really weren't great.
Okay.
And that maybe there could be a better answer. And it was in this time that the allergies I'd suffered with for years and years and years and years and years finally were getting cured by an alternative therapy. And I was like, what? That's based on Chinese medicine. Maybe I should look more into that. And then kind of fell in the rabbit hole, and I've been in love with it ever since.
Very good.
So yeah.
So how long ago was it that you decided to switch from kind of pre-Western med over to Oriental medicine? So you're a doctor of Oriental medicine, is that correct?
So that's my degree or my certification.
Okay.
And I don't know, that was a decade ago now at least.
Okay.
And yeah, it's what I really like, though, is having done a little bit of both. It gives me an appreciation that both are powerful, wonderful things.
Yes.
And I think we're going to reach our best results when we work together.
So when did you decide to open up this business of Weeks Integrative Medicine?
So that I opened about 3 years ago, I think.
Okay.
2-3 years ago. And it was, I was getting too busy as just a solo practitioner. I was really thinking, well, how can when I expand, my office and things, what do I really want to, what do I want to accomplish? What do I want to create? And my goal was to create a space where people can come and see a team of people, get a lot of their needs addressed, and, we can try to provide as much care for someone as they possibly can with practitioners who actually like working with each other and will listen to each other and work together to provide the best patient care possible. And so that's kind of the dream.
Very good.
We're building it bit by bit.
Very good. Now, can you talk about some of the different aspects of your business? I know you have acupuncture as part of it, and herbal medicine, and the advanced allergy therapeutics. Talk about the different branches kind of your business.
Okay, so the things that I personally do, I do acupuncture, but within acupuncture I actually do two very specialist styles.
Okay.
One is called neuroacupuncture, which is based on neurology and an understanding of neuroanatomy and neurophysiology and neurochemistry and how we can stimulate different regions of the brain using needles in the scalp, and how that can affect the brain's ability to process. And so that works really well for people with different kinds of nervous system disorders. So I've seen some really amazing things. People who couldn't talk or could only make unclear noises. They're actually speaking in coherent sentences again.
Wow.
Or someone sitting in that chair you were sitting in. I had them look across the street, and I was like, "Hey, can you read the sign on the coffee shop across the street?" And they're like, "What sign?" And I was like, "Okay, let's," did some needles on the visual cortex area, and at the end of it, she was like, "Hey, that says Little Bear Coffee," and I was like, "Yes, it does.
Wow.
That's amazing."
Wow.
And so,
that's exciting.
I get some really exciting days.
That's
I mean,
neat.
and it's medicine, not magic.
Right.
There's no
Right.
guarantees. It's not everybody, but sometimes you get some really beautiful stuff that happens.
That's amazing. So what are some of your favorite things to treat?
Well, I mean, so I love treating everything, but probably the most popular things that I get to treat that I really enjoy, I love treating people for pain. I love treating neurological disorders, in particular, kind of ADD, ADHD. I love working with anxiety and stress, which has been pretty common lately. And I actually really enjoy working with people with kind of allergies, food sensitivities, or I eat this and I feel bad.
Right.
And that's something I've had a lot of success working with as well, and I really enjoy that.
Okay, speaking of that, we have firsthand experience. My wife had some extreme gluten sensitivities and dairy sensitivities, and after being treated here, she's able to eat pizza. She literally cried. She was like, "This is so good. I haven't had a real piece of pizza in over a decade." And we know multiple other people that have been helped significantly with a variety of different food sensitivities, both food-based and environmental. So I deal with allergies with all the pollen in the air here in Albuquerque, as I know many other people do. So I'm currently being treated for some of those. But anyways, yeah, it's exciting what you can do to help people with allergies.
Yeah, I love what I get to do. It makes me happy. I don't go home sad.
Yeah.
I love what I do, and it's a great thing.
Very good. If you're interested in more information on that, come in and you can speak with him directly about some of the techniques that he can use to treat allergies.
Absolutely.
Moving on from the business side of things, wanted to ask, what are some of the things you enjoy doing outside of work?
Outside of work, I mean, I'm a husband and a father to two sweet little girls, and we just got a puppy, so a lot of life these days is, playing with the dog, playing with the family. We go for hikes, or, I love cooking.
Very good.
And, my kids are getting slightly old enough, so now they can actually, I was teaching my daughter how to make an omelet the other day, and it was pretty exciting.
That's fun. That's fun. Well, when you have somebody else cook for you, what are some of your favorite restaurants nearby?
Oh, so that's a great question. It also depends on what genre you're talking about.
Yes.
Because, one of my favorite places is right around the corner. It's called Bamboo Grill. It's a fantastic little Vietnamese restaurant.
Okay.
And they've got, kind of the best. They've got the best pho that I've had in town.
Okay.
They've got a wok fried noodle that's really good. They're a great restaurant. They started, I felt kind of bad for them because they started in January of 2020. And then we're open for a whopping, month and a half. And then they were closed and opened and closed.
Okay. But they made it, and they're still...
But they're still around, and they should be, hopefully, for a long time, because their food is fantastic.
Very good. Good to know. Well, then, a surprise question I like to ask everyone is, are you a red, green, or Christmas guy when it comes to chili?
It depends entirely what it's on.
Okay. What about breakfast foods, like the omelets?
Breakfast foods and what? I tend to prefer reds.
Okay.
Chopped green, though, is better with chicken and, stuffed inside breakfast burritos. We go for the chopped green.
Very good. I also think that it depends on the food, but I always like to ask. So.
It's an important question.
Very good. Well, again, Dr. Shawn Weeks with Weeks Integrative Medicine. And Dr. Weeks, if somebody wants to get a hold of you, what are the best ways to contact your office?
So if you call the office, one of my assistants would be happy to talk to you and get you an appointment or answer any questions. If you have questions for me specifically, you can always feel to leave a message and I'll try to get back to you. If you call the office, it's 505-281-8891. Or you can email info@weeksintegrativemedicine.com. We're always happy to hear from you. Love to talk to people. Love to work with people. Yeah.
Very good. Okay. Well, thank you for your time, Dr. Weeks. It's very exciting, and I learned several things even just during the interview. So thank you for your time.
It's a pleasure, John. Thanks for coming out.
Thank you very much.
Mm-hmm.
Goodbye.